The American Health Journal is brought to you by the National Healthcare Media Organization, bringing the latest in healthcare education to the American home.
This program is being brought to you in part by MedMovie. Illustrating life. Powerful visuals for health and medicine.
Closed captioning provided by a generous grant from HF Healthcare, infusing health right to your home.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello, and welcome to this special edition of the American Health Journal. I'm your host, Chris Long. We want to share with you a new wave of laser technology that has not only reinvented dentistry and revolutionized nearly every type of surgery, but has forever changed the standard of care for patients. We visited the World Clinical Laser Institute Super Symposium in Huntington Beach, where they are conducting a weekend event to educate and inform medical professionals about Waterlase technology. We heard from physicians, dentists, and medical professionals at the event about how Waterlase technology has changed their practice and the numerous applications that are possible with this remarkable technology. Now, on the American Health Journal. Periodontal disease is an infection of the tissues that support the teeth. Often, this results in losing your teeth or having them extracted. One of the speakers here at the symposium, Dr. Rana Al-Falaki, a periodontist and researcher, discussed how using Waterlase on her patients with periodontal disease has saved their teeth.
I use the Biolase Waterlase technology for everything that I do now in my clinical practice. We use it to treat periodontal disease, get rid of inflammation, and the results we've seen have just been absolutely magnificent, far better than we used to get through conventional treatments. But at the same time, obviously, we do a lot of surgical work, so we'll use it for things that we call crown lengthening, so gummy smiles, cosmetic work, gum grafts, what's known as peri-implantitis, so people who have failing implants. The Waterlase technology works amazingly for that, where previously there hasn't been any sort of really good, successful, predictable treatment for it. We use it for all other kinds of surgery, to the extent where now surgery isn't a rude word in our practice anymore, because before people used to really not want to have surgical treatment and have a lot of pain and swelling and morbidity afterwards, whereas now when we do it with the Waterlase, it's like we give them one ibuprofen at the end and they come back saying, I don't know why I was worried about anything. So it really, really has transformed our practice in every way. As I started using the Waterlase, there's something that we aim to be the gold standard in the treatment of periodontitis and gum disease, which is to actually try to regenerate the tissue, so make the bone grow back. And previously, the only predictable way of doing that is to do bone grafting surgery, which is expensive, painful, and you kind of hope that you're going to get success. And what we've seen now through the just minimally invasive treating the whole mouth with the Waterlase technology is the bone has been growing back on its own spontaneously. So people are getting firm teeth and are healthier and happier. Obviously a lot less expensively as well, and with much less pain. So we've brought this into the hospitals, so we're looking at conducting clinical trials to actually prove the point in the scientific forum, to really revolutionize the world of periodontics as well. It's really the next most amazing big thing, really. People come from all over the UK, hours and hours to come to see me because I have the Waterlase.
Dr. Al-Falaki shares how a patient's previous dentist was going to treat her condition.
And he had wanted to take out 8 of her teeth. She'd had so much periodontal work done, both actually, funnily enough, in the UK and the USA, and none of it had really worked. So I think he decided, okay, enough is enough, it's time to start taking teeth out. And he was going to make her a big plate. And obviously this is the start of things. When you start to lose teeth through gum disease, it's just a downhill battle. So she came to see me for a second opinion, and I said to her, absolutely, don't take any of those teeth out, let's treat them. So we treated her whole mouth with the Waterlase, And within 2 months, she came back and her teeth are solid. She hasn't got any more gum disease. She's shown great stability over the last year. She hasn't needed any surgery. And that's what made me think it is a good day. And I tweet about it. When I have a day like that, I send tweets through because, you know, you just feel so lifted and motivated that this has got to be the way to go.
Coming up, a new standard of care emerging that will vastly benefit patients. Oral bacteria and periodontal disease are suspected contributing factors for which medical condition? A, cardiovascular disease, B, pulmonary disease, C, diabetes, D, kidney disease, E, all of the above. The answer when we return.
Join the American Health Journal on Facebook. Search for American Health Journal.
Oral bacteria and periodontal disease are suspected contributing factors for which medical condition? The answer is E, all of the above. Procedures like Waterlase treat the root cause of the disease and then prevent the chronic disorders. After comparing conventional methods in dentistry to laser-assisted technology, Dr. John Hendy came to the realization that a new standard of care was emerging. Waterlase would change how dentistry was going to evolve.
Approximately 12 years ago plus, when I first got my Waterlase, I was doing procedures, the standard of care, and I started adding the Waterlase laser to that, and then eventually the diode lasers. And I found that with the use of laser dentistry, I could do much superior dentistry to the point where standard of care was substandard, and I thought unethical for me to perform substandard care on my patients. They deserve the best. We were investigating this new radial firing periodontal tip, and we were doing some treatment on a couple of patients. We decided to do the standard that they've done for years. Ask the patient if they'd like to see which one worked the best for them. Conventional treatment or the laser-assisted treatment. And so we did half the mouth with standard, other half with laser-assisted. And we did 2 patients. By the time they came back for healing and to check on the healing, there was such an overwhelming difference that we felt then standard of care for doing periodontal treatment was substandard in our office. We had just elevated to a new level that I couldn't even put any more patients through, even asking them if they wanted to see which one worked the best for them, because we didn't know, and now we knew. It was so overwhelming as to what we could achieve that we abandoned that particular study just because our results were just overwhelming. You get little micro cracks with using a drill, and it's from the vibration. If you get something out of concentric, it vibrates and it can damage the tooth. With the Waterlase, you don't have that. It's all light energy, so it's not going to create those cracks. You also have cracks in root canals. If you do root canals incorrectly, you can cause a crack in the root. With the Waterlase lasers, we clean out root canals so efficiently, we don't have to be as aggressive as the standard is. And so there again, in root canals, we change the standards. Recently, I had my hygienist who does a lot of my periodontal work with the lasers. She's one of the only few licensed hygienists who can do it with the erbium lasers, which are Waterlase, as opposed to the diode lasers, which are the standard that most hygienists work with. And we did a comparative study, which was a 3-year-long study of our patients and the results. And so this is a new milestone in laser periodontics. And these results we've been showing to doctors all over the world, and they can't believe the results we're getting because it's something that's not heard of usually. I believe some of the new technology like this is definitely saving lives, because basically when you have periodontal disease, there's right now about 30,000 plus articles on PubMed that relate periodontal disease to heart attacks and strokes. And the thing is my uncle died of pancreatic cancer. He had gum disease. He was in Germany. He wasn't being treated for it. The thing is now we know 70% greater chance of getting pancreatic cancer if you have gum disease. So if we're clearing all these diseases up and preventing these diseases from ever occurring because we're clearing up periodontal disease, I think we are affecting it.
We'll be back with much more from the symposium.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
We now go to Laura Windsor with more information on Waterlase.
Thank you, Chris. Among the speakers here at the symposium were two associates of a pediatric dental practice, Dr. Rashida Jeju and Dr. Linda Dean DeRue, who talked about the benefits of using Waterlase on their young patients.
I think Biolase has changed the face of dentistry for a big portion of the dentists who are advanced technology oriented. They have embraced this technology for how well it does for their practice, sets their practice apart from everybody else. It is really an everyday thing. I think today in our practice, we use laser for 99% of the procedures that we provide for kids. There are so many good parts to being a Waterlase dentist. I think for a child to not have to worry about being numb while I am working and after I'm working, not having the tingling feeling that is sometimes annoying because it feels like pins and needles in your mouth. But the perfectly awesome part is when you are done and the child says, "I'm done." That is the best part, and it always makes it so good for parents to see that, for our staff to see that, and for us to know that I truly made it comfortable for this child, for them to not know that the entire visit is over.
When I discovered the Waterlase, it was like night and day. I was just so happy to be able to do fillings and treat children without having to give them Novocaine, which we've gotten really good at as a pediatric dentist. However, after the procedure is finished, the child is always still frustrated because they are still numb. And so for me, it was a dream come true. It was to be able to give children what I wanted for them and not having them be in pain and have them even still be comfortable after the procedure. Over 95% of our children do not get Novocaine when they have fillings done. So that is huge for us. That means we've eliminated the fear of dentistry, and we have children who are happy to come. And the best part for them is when you finish and you tell them they can eat right away, they are so happy. And even the parents do not believe that, but it is true. And we've always made it our goal to make sure that we create a new generation of children who are not afraid to go to the dentist. So using the Waterlase sort of kind of ties into that. And the parents are just so glad because they're always so fearful. It's very common to see some of them just shedding tears of joy at how happy their kids were getting dental treatment in our chairs. So yes, knowing and using Waterlase does affect everyone. I'm happier for it. I go home much happier because I've delivered a full day of joy to a lot of patients and parents.
It is also still remains the future of dentistry because I teach at Children's Hospital in DC, and most residents do not get exposed to laser dentistry unless I am doing my laser lecture towards the end of their residency program. So when lasers become a part of the educational process, they will become the true present of dentistry. Right now, they are the present and future of dentistry still.
The advantages of this Waterlase technology is while it makes for a painless dental visit for the child, it brings considerable relief to the parent too. For the American Health Journal, I'm Laura Windsor.
Straight ahead, we'll learn how bad breath can be effectively treated using Waterlase.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
Keynote speaker at the event, Dr. Joseph Crespi, an ear, nose, and throat specialist, has done extensive research on the causes of halitosis or bad breath. He was eager to share his knowledge on how to treat this condition effectively using Waterlase.
ENT doctors have been using lasers probably for about 3 decades or more. They were first to adapt lasers in their surgical armamentarium, more so than any other subspecialties. So bringing a new wavelength, a new device with specific parameters, specific laser tissue interaction effect, such as soft tissue and hard tissue effect. It's a new event for otolaryngologists, and it will lead the future for ENT surgery. 70 million people in this country, they suffer from bad breath. It's constant. It's not that you're having a garlic or onion that's going to go away 2-3 hours. It's day after day, night after night, persistent bad breath. What's happening is the bacteria in their oral cavity, they breaks down on the protein and they produce this volatile sulfur compounds as gases, and it can be quite disturbing to the immediate environment, say at work or at home. Management can be quite difficult. Typical books will advise mechanical and chemical therapy, meaning brush your teeth, scrape your tongue, use a mouthwash to decrease the bacteria count. That's not enough. Certainly for the most people that they have chronic bad breath, they have perfect teeth, perfect gums, and you have to search for other sources. The source 99% of the time is in the mouth, the back of the tongue, or the tonsils. Look for the source, treat the source.
Dr. Crespi tells us how halitosis became his area of interest.
This was my research hobby for the last decade. I've been lecturing around the world about bad breath, and my passion has been lasers for many years. So my goal was to find out a laser wavelength, a laser tool or a device in order to decrease the bacteria count to the level that they're not going to be totally eliminated. However, they can be managed for a long term. And the 940 laser and the Waterlase becomes a hand-to-hand tool where we can decrease effectively the bacteria count, the back of the tongue and at the tonsil area, to improve bad breath. Similar, my vision is, that's what I'm going to teach tomorrow to 300 dentists. I'm going to show them how to reduce the bacteria in their oral cavity once they're done with clean teeth and clean gums in the back of the tongue. Very simple. You take the Waterlase, you have water energy, air energy, and also laser energy to decrease the coating in the back of the tongue. Patients will come to the dental office similar to their annual or biannual visit for dental cleaning. They will receive tongue cleaning to maintain their oral bacteria in a manageable level for these patients not to suffer.
Stay with us for more interesting insights into medical breakthroughs using this laser technology.
Join the American Health Journal on Facebook. Search for American Health Journal.
Let's go back now to Laura Windsor to hear how Waterlase is used for cosmetic procedures.
Thank you, Chris. Imagine scarless healing when having a mole and brown spot removed or other cosmetic procedures done. Plastic surgeon Dr. Douglas Hendricks talks about how using Waterlase on skin tissue can produce scarless results.
Biolase very kindly called me, contacted me, we met, and they asked me to see what this can do. on the outside of the mouth, in the areas that are not dental. So I've basically used the laser from tip of the head to the bottom of the foot. It's an amazing tool. I don't know where I'd be without it. In Southern California, many people, most people over 50 years old have experienced at least one skin cancer. And to offer them an option besides making a big cut in the area, cutting out a football shape, bringing it together, leaving them a linear scar with railroad track marks on either side from the stitches, is a very attractive alternative. In fact, many people, I think, avoid asking doctors about excising an unsightly mole because they're concerned that the scar will be even more unsightly. And I can't just get the word out fast enough that I have an alternative to that that is safe, effective, and essentially scarless. This patient is a 43-year-old and came to me about a troublesome brown spot on his cheek. Fortunately, the Waterlase gives me the ability to treat this in a way that is not possible with any other device. With the Waterlase, there's a unique ability to treat spider veins. The Biolase specifically, because of its unique characteristics, I can treat the vein by bringing the laser very close to it, transmitting some of the heat without really a sensation to the patient of much heat. And that causes the vein to coagulate right there at that spot. And so what you're doing is creating dams all along with that spider vein with minimal trauma to the skin, keeping the skin cool with that water and air spray, so there's not thermal damage to the skin that would result in a noticeable scar. With the Waterlase, I've been able to do incisional surgery as well. I've done blepharoplasty surgery. As you may be aware, that's removing the extra skin and the underlying tissue. That it still requires some anesthesia. It's not completely eliminated the need for anesthesia, but I've been able to do that with very clear surgery. The laser will cauterize or coagulate the tiny little veins as I'm removing the skin or making a skin incision, and that makes the field very clear. It's very easy to see, and so that's been very beneficial as well. I've taken care of a diabetic foot ulcer, and one of my relatives that was completely down to the bone. I was just showing one of the gentlemen here that photograph, and after it's healed, I have a photograph of after it's healed, you can't even see a scar where this ulcer was, and it was right down to the bone. Every family get-together that we have, when we're standing around praying before the meal, he will also add, and thank you to Doug for helping save my foot. He's so grateful. He won't let anybody forget that.
The possibilities of using Waterlase for cosmetic procedures is endless and still evolving. We'll continue to follow this fascinating technology. For the American Health Journal, I'm Laura Windsor.
We will return with more on Waterlase here on the American Health Journal.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
We conclude our visit to the symposium with an opportunity to hear from the president of Biolase, Alex Arrow.
Waterlase technology is going to be used in more applications throughout the body than it is today. Dentistry is essentially the first niche market in which it has proven clinical utility. But we think it's only the beginning. Because we can atraumatically ablate any tissue that has water, which is all tissues of the body, it can be used in orthopedics, in dermatology, in ophthalmology, in otolaryngology, ENT medicine, in podiatry.
We use the Waterlase on virtually every patient that we treat cosmetically. Number one, with the Waterlase, we can recontour gingival tissues, gum tissues, to make everything even and more aesthetic prior to doing our crowns or veneer preps. Take our impressions, make our temporaries, insert our veneers a week or two later, and the tissue stays exactly where we left it. With the Waterlase, the same day the patient comes into the office for the crowns or the veneers, we do the hard tissue crown lengthenings, usually in 5 minutes or less, There's no postoperative discomfort, and they walk out that day with their temporary crown, or if they're doing a CAD/CAM crown that's milled in the office, they get their permanent crown veneer the same day. It's absolutely remarkable.
Dr. Howard Golan shares a patient's story.
A 4-year-old actually came into my office. He had 2 cavities in the front, 2 teeth. And at 4 years old, they don't understand, and they're afraid of everything that's coming after them. And we did 2 cavity preparations with no drill, no anesthesia, no injection, no fat lip, no squirming, no crying, and we washed the bugs away with a water spray. And the mom looked at me and said, "Are you serious?" Like, we were so afraid of that, and that's what we get the reaction every day. It's an amazing thing.
About 2 years ago, I was introduced to the Waterlase, and that's when I really began to see a vast difference in my results for my patients. You know, it was a phenomenal difference in the healing that we were getting and the decreased sensitivity to them, and their overall experience was so much better from the old way that we used to do things. So it's just something I'll never go back. You know, once I've done this, it's life-changing for me and for my patients, and with the knowledge that I have now, going forward, this is the only way I'll practice.
When I first came to a WCLI, I didn't own a laser yet. It was after seeing the excitement level and seeing all the procedures that could be done with it that it's like, yeah, this is happening. I remember my wife saying, she says, "Do you think that this is where dentistry is going?" And I said, "Yeah, I really do." And I've got the 3rd generation of lasers from that point. So each time it's easier to upgrade. So it's something that I can't imagine being without at this point.
We as a company face challenges in spreading the adoption of this technology throughout the dental community. Our challenge is to reach the big middle of the bell curve, those dentists who are fine with their existing practice procedures using conventional dentistry and haven't seen the urgency to make the transition to start using laser dentistry to spare their patients from some of the pain, inconveniences, and disadvantages of using drills, Novocaine, and conventional dental instruments. And my challenge in particular is to get this company into that accelerated portion of the curve by getting the big middle of the market to understand that they need this technology so that they do not get left behind.
Thank you for joining us on this special edition of the American Health Journal. We would like to thank the World Clinical Laser Institute, Biolase, and the medical professionals for their participation in making this program possible. If you would like to see this program online, check out thedoctorshow.com. Click on the View Shows tab and on the show you would like to view. As always, we'll continue to keep you current on the latest and best in medicine for your better health. For American Health Journal, I'm Chris Long.